I absolutely hate it. Like when friends take pictures or videos of me, I'll be like, delete it, delete it, delete it. And they're like, why? And I'll be like, look at, the first thing I notice is my eye. And I hate it. It really bothers me.
Well, you're about to look like yourself again.
Yeah.
A little bit underneath.
It's like not me.
Can I zoom in? Let me just,
Wait, I'm crying.
wait a second.
No, we can go. Are we filming now? I am getting orbital decompression from Dr. Douglas. I don't see double vision, and I don't feel any pain. I actually don't feel anything. I just don't like my appearance. I was diagnosed with Graves' disease and I had radioactive iodine back in 2011. So I really don't have any other symptoms after that. It's so nice to meet you.
How are you doing?
Good, how are you?
What we might do, and I'm gonna look, is we might lower this lid just a tiny bit. See what a difference that makes? It's like a millimeter. But see how your other lid has this slope? Mm-hmm. What's gonna happen, and we've published lots of papers about this, is that the lower eyelid's gonna come up and look much more natural just like that.
My mother has been telling me to go to Dr. Raymond Douglas for about 5 years now, when he was at U of M. And I'd say, yeah, I'm gonna go, and then I would never go, and I'd never make an appointment. I mean, I was only 20, 21. I was trying to live a normal life, you know. Doctor's appointment was the last thing I wanted to go to, especially because my eye wasn't that bad yet. But it was bulged, but enough for me to hide it still. The camera didn't notice it yet. So I got away with it for a long time, and then by the time I realized it was more noticeable, I was like, I can't hide it anymore. I can't take a picture anymore. I don't like the way it looks. And by the time I went to U of M, Dr. Douglas had already opened his own private practice out in California, Beverly Hills. So that's why I'm here today. This was me right out of surgery.
I'm feeling slight pain, but not a lot. If I move my eye, it hurts. It looks worse than it feels though.
She had an orbital decompression done, and we did a little modification of the eyelids, but what we mostly did is moved her eye back into the normal position so that now her eyelids match, the eyes look the same, and she no longer feels self-conscious about it. We did that through a tiny little incision up in the eyelid crease, and were able to make that heal really nicely, and just shave down a little bit of bone, which is actually not as bad as it sounds, hopefully, and you can get some really nice, beautiful results.
One more.